There's growing concern here in the U.S. over a highly contagious coronavirus variant first detected in India that has quickly become the dominant strain in the U.K. The chief medical advisor to the president, Dr. Anthony Fauci, warned yesterday that the Delta variant now accounts for more than 6% of all infections in the U.S. The dangerous strain, which may be associated with more severe disease and a higher risk of hospitalization, is spreading rapidly in parts of England. It's responsible for more than 60% of cases there. For more on this, let's bring in Dr. Neeta Ogden. She's an internal medicine specialist and immunologist. Thanks for joining us again, doctor. So what more can you tell us about the Delta variant and whether or not we know if the vaccines that we are taking are effective against it?
Good morning. Yes, the Delta variant is an alarming variant that originated in India and has now, as you said, spread to the UK, become the dominant strain of COVID there. And I think this is kind of the new normal that we're going to be hearing about as COVID continues to exist globally, these variants. So what do we know is that in the UK, which has had a very successful vaccination program with 40% of people basically receiving 2 doses or 1 full dose of, actually they have Moderna, Pfizer, and AstraZeneca vaccines in UK. So it is 2 doses and 60% of people receiving 1 dose. What they found is that these new cases are pretty much occurring in people who are unvaccinated or partially vaccinated. So they've received only 1 dose and it might be, quite soon after that. They've reported that only 3 cases of fully vaccinated people ended up in the hospital from this variant. So I think this is really encouraging about this variant and vaccine immunity and how that could play out in the United States. And we have to keep in mind, though, that the UK is one of the most, developed countries in terms of tracking strains and the COVID virus in general. I don't think we necessarily have such a good understanding of the prevalence of this strain and how it's affecting other countries because they simply don't have and aren't using that same technology all over the world. So I kind of wonder, it remains to be seen how it plays out in the rest of the world. In the United States, I think we're in a fairly good position against this variant, but it just basically begs the question, what happens with the next variant and the variant after that when people still are hesitant to get the vaccine?
So, Dr. Ogden, it appears unlikely that the U.S. will reach the president's goal to have 70% of adults at least partially vaccinated by July 4th. We've talked about some of the issues that are the challenges, I guess, that the president and the administration is facing. Break that down for our viewers.
Yeah, I think that at this point, we need 15 million Americans to get 1 dose of the vaccine to achieve that goal of President Biden's. And we've really dropped from up to 2 million doses a day down to 400,000. I think at this point, the Biden administration really needs to evaluate strategies, the things that sort of worked before, for example, when the vaccine was sort of approved for different groups. And then for, most recently, adolescents, there is this, excitement around it and people rush to get it. But then that sort of falls to the wayside. And the same thing has occurred with these incentives that have been given around, like in Ohio, the $1 million kind of lotteries. That sort of has, just a short-lived effect. And so I think that they're really going to have to examine where people are getting their information, why they aren't being swayed towards having that vaccine and putting more of a grassroots effort there rather than sort of relying on what's worked before.
So meanwhile, San Francisco, which I think was one of the earliest cities to lock down because of this pandemic, well, they've had a 0 death rate for COVID in the city, and some experts say that it's going to be the first city in the U.S. to actually reach herd immunity. They're doing something right. What are they getting right?
Yeah, I think it's so encouraging to see this about San Francisco, given what California went through at the height of the coronavirus. And there are a lot of things going on with San Francisco. I think that it speaks a bit to the population. People report that there are fewer children in San Francisco. There's more adults who can get vaccinated. They're also, as a population, more receptive to COVID measures that were in place before the vaccine and more open to getting the vaccine. Because of San Francisco's compact geography, healthcare workers have actually been able to really go from door to door and vaccinate people, older people who don't have access to, we've talked about so many times, getting on the internet, making a vaccine appointment. So they're actually physically going out and giving vaccines. And then there are a large number of people who have had the virus. So all of that put together leads to this great picture of herd immunity. They're reporting, I think, 13 cases recently in some of these days. I mean, that's really, really encouraging. And I think it does speak to a model, but, that other states could follow. Unfortunately, we're not necessarily seeing that across the board in the United States.
Pfizer and Moderna have begun testing vaccines in children under 12. Pfizer hopes to extend that to infants as young as 6 months in the next few weeks. How soon could we see a vaccine available for kids in that age group?
So Pfizer and Moderna are, getting those studies underway and are basically saying that they're going to have data for these groups basically by this fall. For the younger age group, that's roughly around 5 to 12 years old, that'll probably be September, so hopefully coinciding with the new school year. And then for the 6 months old to 2 years roughly, it'll be more like October and November. And I think the important things to keep in mind is they're doing this in a very deliberate fashion by taking the adult dose and now modifying it for the younger population of like 5 to 12 years old. They're sharing that the dose will be about a third of the adult dose at 10 micrograms. And for then the younger ages below that, the 6-month-old to roughly 2 years old, it'll be even smaller, about 3 micrograms. And they're really, really honing in a very slow fashion at looking at what is the dose that can be most effective and most safe for these groups of children. So I think that, we'll expect to see that data this fall.
All right, so before we let you go, the FDA has approved a groundbreaking drug to fight obesity. What can you tell us about this drug and the results seen in clinical trials?
Yeah, the drug Wegovy is similar to an existing drug on the market, Ozempic, and it's really a hallmark of how we're treating obesity now. This is an entity that is a diagnosis similar to hypertension or high cholesterol, and we need to take it as seriously. It's approved for people who have obesity or overweight and one other existing medical problem. It was shown that these people lost roughly 17% of their body weight. The greatest side effects were nausea and diarrhea, so kind of like GI side effects. And it works by interacting with brain signaling and controlling appetite. So you're actually no longer sort of making it all on the person. This is about willpower and diet, and giving them medication as we would for other medical problems to help them achieve these goal weights and better health.
Dr. Neeta Ogden, always great to have you. Thank you very much.
Thanks for having me.